Good morning, and welcome to the Community Health Worker Prepare webinar number 1. Last week, I had the opportunity to visit the Michigan Primary Care Association and Great Bay Health Center in Saginaw, Michigan, to learn more about their community health worker work in Prepare in Michigan and how they're deploying it across the state. So we're in for a big treat on the next couple of webinars that we have planned. This webinar is made possible by our community health worker funding and the community health worker program that we're doing in Missouri. The webinar today will be recorded for future on-demand viewing and will be uploaded to the CHW section of the MPCA webpage as soon as that is available. I will also send out an evaluation for the recording as well as the live broadcast, and we ask that all those that participate complete that evaluation, because that is extremely helpful for us to be able to make additional improvements and enhancements as we go along. It's my pleasure to introduce Julie Tatko of the Michigan Primary Care Association. Julie has been overseeing the community health worker work in Michigan and will share a great deal of information about the resources, and she has planned for our two-part webinar series, this initial one to discuss some of the supports and resources and best practices for using Prepare. And then also on the webinar, the next webinar, she'll get into more of the implementation for community health workers on how this work works. So Julie, I'll turn it over to you.
And good morning, everyone. I'd like to start this morning by giving you a sense of some of the background and parallels between our two states. We are going to be sharing this information this morning based on many lessons learned here in Michigan over the past couple of years, but certainly we see ourselves in a learning mode as well. In Michigan, we have 40 community health centers, and about 2.5 years ago, the Michigan Primary Care Association supported a statewide community health worker initiative that funded 28 CHWs in 16 of those health centers. At this point in time, Prepare as an assessment was being piloted around the nation, and so we chose to use it in order to align with a standardized social determinants of health documentation approach that were taking place in other states. This initiative, this community health worker initiative, paved the way for a Medicaid primary care health homes in 10 health centers in the state, which has also enhanced our experience in using this assessment. In this webinar, I'd like to walk us through 3 main topics. First, we'll look at the essential components that are in place at health centers with successfully integrated CHWs. Then we'll look at best practices and considerations for CHWs to use Prepare in their interactions with patients. We will have a second part of the webinar series that will be hosted next week, and we'll get to dig into some of these topics a little bit more in depth. So I'd like to start, although I think many of you are already familiar with it, with the definition of a community health worker as provided by the American Public Health Association. That definition says that a CHW is a frontline public health worker who is a trusted member of and/or has an unusually close understanding of the community served. Note that this definition is broader than a job description and that it emphasizes the CHW's identity as a trusted community member. This trusting relationship enables CHWs to serve as a liaison or an intermediary between health and social services, or in this case the health center, and the community to facilitate access to services and to improve the quality and cultural competence of service delivery. CHWs also build individual and community capacity by increasing health knowledge and self-sufficiency through a range of activities, such as but not limited to outreach, community education, informal counseling, social support, and advocacy. CHWs and lay health workers, and I think that they're known by many other names as well, have a long, rich history of caring for the health of their communities. But adopting this role into the clinical setting may be a new experience for your health center. So when I use the term integrated CHWs, what do I mean? In this model, CHWs become critical extenders of the care team beyond the 4 walls of the health center. Rather than replace existing care team members, They instead add efficiencies to the team by allowing each member to work to the top of their scope. CHWs also serve as the intermediaries that link clinical services to practical actions in the community to address the social determinants of health. They are in the unique position of working both in the health center with patients and visiting with them in their homes and communities. Their specialty is in leading the care team to address the social determinants of health, and they do this by identifying patient barriers and supporting the patient to work through them. It is important to note, because I've seen this happen time and time again, that CHWs are not used as replacement staff for front desk, medical billing, outreach and enrollment, unless that outreach and enrollment is a specified part of their role. While the CHWs, each of the health centers statewide in Missouri that are implementing this new community health worker project may have a different focus tailored to the communities that you serve, there are essential components that need to be in place for the CHWs to thrive. Dr. Noelle Wiggins at the Community Capacitation Center at the Multnomah County Health Department in Oregon, who's been doing this work for many more years than us, calls them necessary conditions, because you'll find these elements in place in health centers that have adopted a successful CHW integrated model of care. The first component is preparation of the care team. All care team members with whom a CHW works should understand the roles of a CHW, the skills that they bring to the team, and the unique ways in which they work. The CHW is a non-clinical team member and is a team member that supports the patient in non-clinical ways. Working alongside a community health worker may be a new experience for the care team members, and it shouldn't have to be the CHW's job to explain who they are and what they do to everyone on their team over and over and over. A practical step that you can take to prepare the care team and keep the integrated model on track is to identify a care team champion. Often, this works well when it's the provider or the lead person on the care team. This particular component is so important that we'll address the care team preparation in depth in our webinar next week, covering roles, communication, and care team supports. Component number 2 is preparation of the CHW, and I know that this is already underway. In order for the CHW to be adequately prepared for their role, they need both initial and ongoing training. The CHW core competencies are provided through the community college course that you're taking. It covers a range of competencies that are common to community health workers regardless of the specific job duty that they're fulfilling. It includes their role, advocacy and outreach, organization and resources, emphasizing community and personal strategies, teaching and capacity building, legal and ethical responsibilities, and then it focuses on some other areas including communication skills and cultural competency, healthy lifestyles, and mental health. There are a number of other trainings that are valuable to the CHW role, and I want to emphasize this as ongoing supplemental training necessary to build and maintain competence. Specific to the patient population that the community health worker is working with are trainings that can support their understanding of specific health conditions, whether that's mild to moderate depression, diabetes, asthma, et cetera. And this training can often be provided by from within the health center by clinical members of the care team, or there may be other opportunities to attend training to learn how to work specifically with diabetes patients from the community health worker perspective. Motivational interviewing is a conversational approach designed to help people identify their readiness, willingness, and ability to change, and this is also a great skill for community health workers to deploy when working with patients and helping them to take those steps to both identifying areas that they're willing to change and steps for making positive change. Some other trainings that have been emphasized by the health centers in Michigan as being very valuable were mental health first aid, training that addressed boundaries, time management, and self-care to prevent CHW burnout and reduce turnover in the position. And then 2 trainings specifically cited as ones that were very valuable that they couldn't get enough of were safety training for home visits and cultural competency, because these are really important for CHWs in serving their patients in an appropriate way. In Michigan, we have safety trainings that are offered by community service troopers with our state police. That's a resource that, that you could look at in your state as well. The third component I want to emphasize is CHW support, and two main areas here. CHWs need a supportive supervisor. Ideally, this is someone who is a CHW themselves, or at least someone with a deep understanding of and a respect for the CHW role. We often overlook this supervisory role when we're putting CHWs in place, but having that support will help your CHW program to thrive and help your community health workers to successfully navigate their role. That supervisor should be someone who recognizes that while very resilient, many CHWs have experienced trauma in their own lives and need reflective and trauma-informed supervision to be able to support patients who are also grappling with serious situations. And that CHW supervisor plays a very important role in monitoring the CHW's safety and in promoting training opportunities. There are additional trainings that are available out there for CHW supervisors, and that's a really positive training opportunity to take advantage of when it comes your way. Additionally, another area of support is mentoring. Mentoring offers additional training and guidance for community health workers and gives them peer support. These mentorship opportunities do not have to come from within your health center if you don't already have a team of experienced community health workers in place. But you can look outside for community health workers that are well established within other programs within Missouri in order to make connections for them. This will help them to gain confidence in their role much more quickly if they are new community health workers. Number 4 is flexible scheduling. In order for CHWs to work effectively and safely in the community, the health center needs policies and supports in place that address home visiting. Many health centers, most in fact, that employ CHWs have successfully navigated allowing them to work in the community, either to visit patients in their homes or to meet at a safe place in the community. And it's those policies and supervision and other supports that make that possible. CHWs also need time within the health center to meet patients when they're in the clinic for a visit, to build relationships with their peers, and to participate in team huddles and other meetings. And then the final component is documentation and care team communication. And with this component, it's something for you to think through as a health center for how do you want communication with the CHW and the care team to happen. Is it by email, EHR stickies, encounter notes, verbally during huddles or another time? Thinking about how should they deal with urgent communication. One of the common ways that care teams communicate is during huddles, and it's important to set up guidelines and participation expectations for CHWs that join those huddles. They'll need orientation, to understand expectations or get training for documenting in the EHR and writing EHR notes. These are valuable forms of communication, and it's worth investing in helping the CHW learn the abbreviations or other shortcuts for documentation. So now I want to move into looking at the PRAPARE assessment itself. For those of you that attended the PRAPARE 101 webinar, you've had a great overview to the protocol as a whole. And what we're going to do here is look specifically at how a CHW can use this assessment both to assess and then respond to patient needs. If you remember that PRAPARE stands for Protocol for Responding to and Assessing Patients' Assets, Risks, and Experiences. And its main strength is in identifying the root causes of poor health outcomes. Its focus is on assessing and documenting patients' risk of poor health. and then assessing that the social determinants that are highlighted within the tool will guide the patient's goals and actions. PRAPARE allows the CHW to write a plan of action along with the patient that's based on the whole set of patient needs rather than just address the one need that the patient presents at a time. And so it's a very holistic approach to supporting patients. We're going to look first at the assessment side, and then we will look at responding to needs that are identified. In order to get started with using PRAPARE, and I believe some of you have already started using it within your health center, so this may give you a place to build toward, but you'll need to work as a care team to develop a workflow that incorporates the CHW and administering PRAPARE. This can be done in a variety of ways, and so I'm going to show you a couple examples and talk through what some different options are, but really to give you a sense of how you can map this out to customize a workflow that works within your healthcare delivery site. First, it's important to establish how patients will be identified for working with the CHWs. This, you may decide that the CHW is going to work and focus on patients with a particular health condition. That's one approach. You may decide that the CHW is there to work with anyone who presents with a real barrier and needs support in accessing social services. Whatever that definition is that you're using, there needs to be a way for the community health worker to be connected to that patient. This information will most likely come from more than one source. So the example that you see here on the screen in front of you is just one of those ways. In this example, the information is coming to the CHW through a team referral. So you can see that if you start up in the box there that during the daily huddles, the team is coming together, and as they talk through patients, they're sharing information about what they know. The MA may say, well, Mr. So-and-so has expressed that he's having difficulty getting his diabetic medicine or insulin. And so that patient is then flagged as a great candidate for working with the community health worker. The provider during the visit then talks to the patient about the CHW services, introduces the CHW and says what he or she will do with the patient. And then the CHW is then in a position to work directly with the patient, to administer the PRAPARE assessment, ask the question, and then work with that patient to prioritize and respond to the needs that are identified. The real question whenever you're mapping out that patient workflow is, what is the patient's experience like within this workflow that we're creating? And so I want to keep that question foremost in your mind. You can do a PDSA cycle or a plan, do, study, act approach to refine this workflow. So this is really intended to get you started. It doesn't have to be what you come up with at first will most likely not be the final workflow that you settle upon. But again, the feedback from the team and the patient's experience are going to shape how you end up settling on a workflow that works within your health center. Here's a second workflow example. In this example, patients are identified through a report based on data pulled from the EHR with their health measures. The community health worker has a list of patients that have been identified or flagged as ones that should work with them. So in this case, it's looking at diabetic patients with an A1C greater than 10. And identifying those as candidates for working with the CHW to see if there are barriers that the CHW can assist with to help get those scores or measures into a healthy place. The CHW then monitors patient visit lists, pays attention to which patients are scheduled each day, cross-checks it with their list, and then is brought into the workflow for the patients to be sure that the CHW meets with those patients when they're in the health center. Simultaneously, the CHW works through their list and calls patients and reaches out to them. And this is a way for them to invite the patient to come in and meet with the community health center or community health worker, or for the CHW to go out and meet with them in their home. The CHW then can ask the PRAPARE questions and work with the patients to prioritize and respond. We have a number of health centers in our state that the CHW themselves do not ask the questions directly, and this is another model that seems to work. It may be the front desk staff or another staff that administers the assessment questions, and then the CHW does the follow-up and works through the answers and interventions with the patient. Providing the right setting for the assessment is an important consideration. If you've read through the PRAPARE questions, you know by now that there are sensitive questions that ask a patient to be vulnerable when sharing their answers. Providing the right setting can ease that discomfort. Many CHWs have found that establishing a relationship with the patient first is preferable to asking the PRAPARE questions the first time they meet. So they may do it on a follow-up visit because they find that that relationship is already established and the person feels comfortable sharing the types of information asked within the PRAPARE assessment. Providing a physical space in the health center is also an important consideration to plan for. Think about where you will give it. If it's in the health center, is there a private space with no interruptions that the CHW can use to meet with the patient? Well, that might be in the or just following the provider's visit with the patient right there in the room, or it may be that the CHW has an office that they can use to ask the questions and sit down with the patient. In some health center settings, space is very tight, and I know that CHWs have had to be very creative with finding space, but this is an important consideration for being able to administer the assessment in a comfortable way for the patient. Also determining when you will give the assessment. This is a consideration for that's going to come out in your workflow as you map that out. But will the assessment be at the first office visit? Will it be as a follow-up? If it's is there a time frame in which you are aiming for that PRAPARE assessment to be given upon the start of the work of the CHW with the patient? These are all important protocols for you to write out and give to your CHW as expectations for administering the program and for making sure that they're following up in a timely way and that all patients are being served in that same way. Again, the question here to answer when considering the assessment is what makes the patient most comfortable and how can the CHW provide that environment? There are a number of ways that you can ask the PRAPARE questions, and how you choose to do it may differ by preference, and that may be a full care team decision, or it may differ from patient to patient. There's no one right way to do this within the CHW model, and I think that you'll find that that as you become comfortable with administering the assessment in different ways, you'll find what works well for you at your health center. You can ask the questions verbally using a motivational interviewing or talk story approach. In this method, the CHW asks questions contained within PRAPARE in a conversational style rather than asking them in order and jotting down the answers in a linear fashion. There are many advantages to this approach, and we provided a lot of supports and training for CHWs in Michigan to do this, but it takes a lot of practice. You need to know the questions well, and you need to you'll really want to get comfortable trying this out with a coworker or a family member before you dive in with a patient. Alternatively, you or another health center staff member can give the assessment to the patient to fill out themselves on paper. And we have many community health workers that are working within that delivery method as well. This works when the patient's literacy level is high and they are adept at filling out paperwork. CHW, to respond to needs identified in this method, will still go over the PRAPARE answers while the patient is there to fill in any gaps or explain any questions that there was confusion around. For existing health center patients, some of the PRAPARE data or the answers to the PRAPARE questions may already be on record in your health center EHR. The CHW can gather some of that data in advance, but I encourage you as a best practice to not assume that all the patient data in the EHR is correct. You can ask the patient to verify demographic information rather than avoid asking it, or rather than assume that what you have on record is current and up to date. And then finally, a tip on asking the questions when using an interpreter. This is, I think, best practice when you're using an interpreter in any situation, speaking directly to the patient and not looking at the interpreter, but really still working to build that trusting relationship with the patient and allowing more time for the questions. The CHWs that we've asked to describe the time frame that they allow in order to really work through the assessment is they allow anywhere between 20 and 40 minutes. And that allows time to work through some of the interventions that are then provided to the patient, or those referrals, upon completion of the PRAPARE. The PRAPARE itself, answering the questions, not so long. But remember, you're doing this all within the intent of being able to respond to the patient and provide them with needed resources. So here are some decisions that the CHW and care teams will need to make when deciding on their workflow and how the PRAPARE questions will be administered to patients. Where will you document the PRAPARE answers? If you have the EHR template available to you and your health center is adopting it, then this is a natural place for that information to be stored within your health center, because all care team members will have access to the answers and have a fuller picture of what's going on with that patient. But if you don't have that resource, where will you document the answers? And this is a similar question being navigated in Michigan. We have health centers that work within EHR systems that for which a template is not available. So these are questions to ask and make decisions on together. How will you communicate needs back to other team members? So needs that are identified within the PRAPARE assessment, how will all members of the care team be able to know what those needs are? Will you communicate those verbally back in the huddle, and how much detail do you want? This will take some refining. It will take some guiding. It will take some experience introducing this level of or this type of information back into the whole health picture of the patient as you're working together as a care team. Many health centers use notes. And we'll talk about that a little bit later, because you're really, I think, also interested in what interventions have been recommended and what referrals have been made, and that's another documentation issue. But coupled with that is just answering about needs in general. And then how often will you administer the PRAPARE questions? Within our statewide community health worker program that we initiated back in 2015, we recommended that they administer the PRAPARE when first starting to work with patients, and then every 6 months. But for a patient that you're working with pretty intensively and you're already in communication with them on a monthly basis, 6 months we received the feedback that was too often. So this is something that you'll need to think about as well. But it is good to establish an expectation for how often that assessment will be given, or at least looking back at those needs questions in particular. So now let's take a look at considerations for how to respond and provide referrals based on the information that's provided within PRAPARE. PRAPARE is an actionable assessment that lends itself really well to a CHW intervention. Each need that's identified within the assessment creates its own pathway to an intervention, along which the CHW guides the patient. There may be many needs identified at a given point, and the patient prioritizes their top needs and goals, because remember, this is a patient-centered approach. One of our CHWs, for example, shared that when working with a pregnant patient, she gave the patient referrals for diapers, knowing that this would be important for her. I mean, it's unavoidable that she's going to need diapers for her baby. But the patient didn't follow up because she was more focused on her pressing needs. And so it's very central for the CHWs to be working with the patients to identify their priority for addressing and responding to referrals. As the CHW makes referrals and linkages to community resources, it's important that they track the success of those referrals. The referral is considered closed or complete when the need has been met and the referral is no longer needed. This may actually take more than one referral to be successful, and it may actually take a long, long time, depending on the availability of resources within the community. So as you are tracking this information and you are staying in touch with the ever-changing needs of your patients, that's the reality of some of the complex situations. And I think that you see that especially in areas like housing or transportation, or areas where infrastructure and larger community supports do not adequately meet the needs of patients. Regardless, as a community health worker, your role is to help link them to the social services that are there, to help them to be creative, to overcome the needs that they have, and to help the health center to be understanding of how those barriers are affecting the patient's health. This chart here displays the logic tree that we created for one of the PRAPARE questions. For each type of need identified within PRAPARE, CHWs were prompted with a subform to complete the documented the referral offered to the patient. And then this subform gave the patient a concrete handout that they could take and understand, okay, this is the community resource that can help me with this need, and here are the steps that I need to take to access that resource. I'm sharing with this chart with you as an example of this pathways concept so that you can adopt this approach with whatever tracking system that you are using. And I imagine that this will be an evolving area of support. I know that you have, as Angela has described, access to REDCap, and so that's going to provide you with some structure. But what I want to talk through here is just the concept of mapping out for each type of need identified within PRAPARE, what are the resources available within your community or within your health center to which the CHW should refer those patients. The CHW will be the resources expert, and they will be most knowledgeable and be building knowledge and community partnership and relationships with those other agencies that provide the supports within the community. But there needs to be this understanding of how to map the needs identified within PRAPARE with those resources, and what is mapping out what is the best approach for helping patients to navigate to get their needs met. Here we have another decision point around how you will, as a care team or as a health center, track referrals, including the completion of that referral or documenting how the need was met, and when you're no longer working with the patient to resolve that particular barrier. I'll show you an example in just a minute about how referrals have been tracked by one of our health centers, but this tracking may also vary depending on what the resources and capabilities of your EHR are, or other tracking mechanisms that you've found successful in the past. And then again, how will you communicate back to other team members what's going on with the patient, whether they are successfully navigating through the barriers and getting needs met, what additional resources are available, how that affects the treatment recommendations or adherence to medication or whatever it is that is then tying back into them being able to achieve healthy outcomes and follow their treatment plan. And then I put up here one more time how often you administer the PRAPARE questions. Again, I think that if you're actively working on interventions with patients, they will be, you have a natural touch point to be building on the relationship that you have and refreshing an awareness of the barriers that the patients are experiencing. Here's an example of documentation by one of the health centers in Michigan and how they've chosen to track the interventions that their CHWs are providing in follow-up to PRAPARE. This particular health center is using one of the EHR PRAPARE templates, and so they they record the answers for PRAPARE within the health center EHR. When they're working with a patient, whether that's at a health center visit or whether that's in the patient's home, they do not record the answers live. They really spend that time focused on making eye contact with the patient, with talking with the patient. They use this talk story approach or this motivational interviewing approach to get the answers that they need in order to fill out the PRAPARE. And then they record that back in the electronic health record so that all members of the care team can see it. Then they use a health action plan template with the patient to identify a priority, and they do this by month. This is all with, they coordinate this tightly with their health homes model. And within that health action plan, the patient identifies their top goal or priority for addressing it within that month. That may not be a barrier that they're experiencing to health, such as a need for social services, but it very well may be. And so the CHW is the lead in helping the patient work through their priority for that month when it's removing a barrier such as food or housing or transportation or getting a job or any of the things that they need in order to be able to focus on healthy outcomes. The health center uses Z codes to indicate which area of need is being actively responded to by the CHW or another care team member. And that Z code goes into the EHR when that need is actively being worked on, and it's removed when the need is considered no longer active. So when that referral is closed and the need is met, then the Z code is removed. And this is the way that this health center chooses to document. I've put here tools that CHWs have identified as being helpful supports to them. And so this is something to consider when you're building a budget to support the CHWs, or you're looking for what they need to equip them to do their job well. I think it's important to consider what CHWs need when they are out in the community, and then what they need when they're in the health center. When they're out in the community, they need to be able to be in touch. They need a cell phone that allows them to be in touch with their supervisor at any time, that gives them the flexibility to connect with patients. We provided CHWs with wireless hotspots and a laptop so that they could do functions on their computers with patients out in the community, such as enrolling in health coverage or other supports that a computer is needed for. And then community health worker programs have talked to us about how they support community health workers in being safe while they're out in the community. And one of the ways that they do this is through code words. An example that the Community Health Center gave us just last week when Angela was visiting and observing their community health worker program was the code words that they use when a community health worker has not returned within an expected amount of time from a home visit. So if the supervisor calls the CHW, she'll ask, have you eaten lunch yet? And if the community health worker responds, no, I have not eaten lunch yet, then they know that something is wrong, and they'll go in and intervene with that visit. So there are supports in place, or the supports need to be in place for the community health workers to effectively manage that space outside of the health center. Within the health center, there are some really practical communication pieces that can help communicate to both patients and help care team members communicate to patients what the community health worker does and how they will specifically support patients. And I think of these as outreach materials. So a flyer for patients that describe CHW services and introduce the community health worker. This is a very practical piece to have on hand. It might be a rack card size or it might be a full-page flyer. A phone script for CHWs to use when they are first calling patients and introducing themselves and talking about the services that they provide and inviting them to come into the health center or to meet with the CHW. And then also helpful is a script for care team members to introduce the CHW to patients when they're doing that warm handoff. I really can't emphasize enough how helpful it is in terms of helping the patient make sense of all of the care team members when the care team members work together to introduce each other and talk about their roles and how they're working and providing support to the patient. Providing a script to the care team members will just ease that introduction and help them to become confident on making that handoff to patients. The CHW's role as an advocate for change really is just driven to the forefront with the responding to PRAPARE questions. They are really promoting change at the individual level by helping remove individual barriers for patients. This expands out to helping a family to access needed resources. And the CHWs at health centers don't limit their services just to the patient, but if a family member needs help, they'll help the family member. And then ultimately, you will be in a position as a health center through the CHW work to see gaps in resources that your community desperately needs, because you're tracking on this larger scale what types of referrals you're making, what are the hardest barriers to overcome for patients. Is there a need for an additional community resource in your community that you could be you could contribute to either providing much needed resources or working with other and partnering with other community organizations to bring that resource into your community. So these are all, I think, woven in and throughout your CHW program. One recommendation I have is to build in the collection of stories and collect success stories from your CHWs and directly from patients throughout your program. If you do that on a consistent basis, you will have a very rich collection and story of the impact that this role plays. This will be extremely important for sustainability and for demonstrating the value that you're bringing as a community health center to patients. It's really unique and different from other delivery of care. We'll talk about that a little bit more in the next webinar in terms of sustainability. But using a story banking approach and asking community health workers to be on the lookout for patients who are willing to share their story and documenting that, documenting patients who are willing to describe directly what an impact that has made, or asking CHWs to provide on a regular basis stories, even if you don't use patient names and you de-identify those stories. That is very valuable for demonstrating the value of the role and being able to share that back not only to the health center and your staff within the health center that are implementing this model, but also beyond to your community. I've listed some resources here, and then in just a couple minutes we'll do questions. I will be providing a handout to Angela to post on your CHW page that addresses the definition of a CHW that you can use to talk to other staff within your health center. Also, a handout that talks about what contribution the CHW makes within a care team environment, which will just help, I think, tease out what the role of a CHW is in contrast to other team members and how that's complementary. But I also want to talk to you about Michigan Primary Care Association CHW Toolkit, because I encourage you to visit this link and just see the list of resources that are there. You'll find many, many helpful, practical resources for working as a CHW, for supervising a CHW, for planning for a CHW program, kind of at all different levels. It contains resources related to supervisory support. It contains sample job descriptions. It contains resources for designing the CHW workflow, example policies and protocols for home visiting. And then for CHWs specifically, there are a number of very practical resources that they can use in their work, such as building a resource guide, different training opportunities, and then resources for outreach and just on-hand resources that are beneficial when working with patients with the CHW. Next week, as Angela mentioned, on May 23rd, we'll host another webinar, and this will focus on the successful integration of CHWs with patient care team members, highlighting roles, communication, and use of PRAPARE with other assessment tools, as well as spread and sustainability. And that will allow us to get a little bit more in depth into understanding how the CHW role within the care team is, how you can really understand that and help get everybody on the right footing for starting out with an integrated model. And then also helping care team members to see the value of PRAPARE within their own work on the clinical side. With that, I'm going to pause, and I believe that you've had the opportunity to send in questions through the question and answer box. If there's any questions that come through, we can start with those, and then perhaps we can open the lines and let you all ask some questions directly.
Great. Thank you so much, Julie. So I think there are no questions in the chat or in the Q&A at the moment. So I think what we will do is I will unmute everyone so that we can potentially have more of a discussion and people can feel free to ask questions. So if you do not plan to speak or ask a question, please mute your own line. All right, everyone is unmuted, so if you have a question, feel free to talk.
They need to turn, if they're on a computer, they need to minimize their speakers.
If you are not speaking, please mute your own line. And then Julie, I think there's a little echo, so if you're not speaking, maybe mute your own line as well.
Yeah, I'm muting my speakers. My speakers are muted.
Okay, I decided to mute everyone again. So if you do have a question, please feel free to put it in the chat or in the Q&A. So it looks like one came in right now. So Julie, Rachel is asking if you could tell us a little more about Z codes and tracking referrals, and she's just wondering how this works within an EHR.
So I can give you some screenshots specifically if that's something that you'd like to see how that looks in a specific EHR. I can't recall off the top of my head which EHR that this particular health center is using to track this, but they did provide us with examples. But what they've done is they've looked at the Z codes in terms of being descriptors of different health services or different supports that are being provided. So they would use the Z code related to transportation if they were working specifically with transportation barriers with a patient, or there's one for housing. There are quite a few Z codes related to those kinds of needs, and so they've identified which ones that they're giving referrals for, and then those are the Z codes that are used with the patient when a particular barrier is being addressed.
And Rachel, in some of the PRAPARE EHR templates that we've developed, it should automatically be associated with PRAPARE responses, and it can get added to the problem list so that it hopefully it's kind of a seamless effort to be able to add the Z codes.
And Michelle, this is Angela. In response to the person's question about the emailing the slideshow, Julie, as long as you're okay with me sharing your slides, I do have a copy of them. Are you okay with me sharing your slides?
I am, but I will provide you with an updated version, but I can do that today.
Okay, awesome. And then also, if there's not any others, I have a couple questions that came to mind as I was listening to the webinar. Julie, in your experience in working with health centers that have CHWs, how important or critical have the home visits been to the success of the community health worker program?
We have health centers that do home visits, and we have health centers that have chosen not to do home visits because that has not been a model that they've implemented. I think that you'll find that you can be successful, but in a more limited way when you restrict the community health center to not going out into the community. It does require a significant amount of support for a community health worker to go into neighborhoods, and they do need support. They need training to do that safely and to do that well. And so some health centers have started by identifying places within the community that could be a meeting point. And that it's really an invaluable tool and strategy for a community health worker to be that presence right there in the community and meet the patient where they are. It helps not only with patients who are limited by transportation barriers or scheduling barriers or whatever it may be that makes it challenging for them to get into the health center and be there to meet with all the folks that they need to meet with within a given amount of time, but it also builds credibility for that community health worker as a member of the community.
Okay, thank you. That's very helpful. Also, for the role of the community health worker and getting them integrated into the care team, have you had health centers in Michigan that have developed standing orders or algorithms for the CHW work?
Can you say a little bit more about that, Angela? Can you give me an example?
So in regards to for referrals from the care team to the community health worker, and you might be getting into this next week, when the community health worker is there in the home, what is their role with the med adherence piece? You know, how do they handle the community health worker knowing when they need to say to the patient, I'm gathering the information and I'll share this and bring this back to the care team and we'll get back with you. Just kind of how they navigate, you know, some of those initial conversations so that you reduce some of the, in some cases with this new role, there could be some misunderstanding or concerns from other members of the care team. Like you said, the community health worker isn't replacing other members of the care team, but initially I could see there could be some butting of heads because the community health worker is possibly filling some of the roles that were previously filled by another member of the care team, and so they're now filling that so that that other member of the care team can go to and provide that higher level of care to the patient. So just having, you know, documents to help them get started and kind of some blueprints for their work might be a better word for it.
I think that this is it's such a crucial point that you raise. And we will go into that more in depth in the second webinar. I really feel like this is such an important issue for care teams to work out together before they present themselves out to patients, because if everyone on the care team understands each other's roles with the introduction of the CHW into the care team, then this just flows beautifully. CHWs are trained really well within their core competency training for understanding what their scope is. They know where really what their role should focus on, and they know when not to step into a situation where they're being asked to give advice that should come, or recommendations that should come from another trained member of the care team. And so what needs to happen within that care team and the health center context is for other care team members to also have that understanding of the CHW's role, and for them to all work together with communication so that there isn't confusion within the care team on who's doing what, and there isn't confusion by the patient either. So you're building that, once that knowledge is built within the care team, then that knowledge is then passed along to the patient. So the patient understands the support that the CHW is giving. The example that you gave in regards to the CHW, you know, being a support for medication adherence, it was a great example. The CHW is able to be the eyes of the provider and the care team in the home to see what medications the patient is actually taking, and to ask them questions about, well, how do you take this, and to be able to record that and bring that information back. And so I think that that's a great example of how the CHW is an extender of the care team, but it also shows the boundaries of that role. We'll talk about this a little bit more on how to get started as a care team for navigating who does what within the care team, and understanding where initially you may start out with some overlapping you may start out with some overlapping in roles. And the reason for this is because health center patients have always been presenting to providers and care teams and community health centers with all of their needs, not just their clinical ones. And so clinical providers on care teams have played a role in providing connections to resources, to helping patients resolve barriers. But the advantage of bringing that community health worker into the care team context is that now there's someone who's dedicated to do that, who comes with some unique abilities to connect and be a bridge. And so it's going to be important to identify who was doing that work within the care team previously, or who's doing it currently, and how do we really pass that along to the CHW so that all the care team members are working at the very top of their scope, what they were trained to do, and how does this free them up to serve patients according to their own training.
Great. Well, thank you, everyone. I believe that's all the time we have. This is Michelle Proser from NAC. We do have another upcoming webinar on community health workers and using PRAPARE, and we'll have an office hour scheduled as well, so please make sure you register for those events, and please make sure you let us know if you have any additional questions. Angela and Julie, thank you so much for your presentation. Julie, do you guys have any other comments that you want to make for the folks still on the phone?
I would like to share that, as Angela said, both this webinar and next week's webinar will be recorded. It is always a challenge to get everybody that's engaged with one project on a webinar live at the same time. That's a common challenge across health centers. And so I encourage you to make sure that this recording is accessed by the folks in your health centers that you know will benefit. And that will, I think, be helpful for everyone engaged in both the CHW, but everyone engaged with interacting with the CHWs in the health centers to have the conversations that they need in order for everyone to have the support to move this forward. And it's been a pleasure being able to present to you this morning. Thank you.